major innovations your government did as it related to healthcare funding was to tie hospital funding to performance in a lot of ways where it hadn't been tied before.
Yes.
When we look at primary care, though, with relatively few exceptions, there are no financial incentives for doctors to see patients in a timely way. Is that something you would consider changing?
That's an interesting thought. You know, some like our family health teams, there is an expectation, there has been for a number of years, that they set aside a certain number of spots for those urgent patients. This is what, you know, among other things, this is what the HQO report has looked at and indicated that there's a lot more work to be done. Right? It's not acceptable. It's a very, very important measurement for Ontarians that they get access to their primary care provider when they need to see him or her. So, but on other things, we do provide incentives. So, for the HQO report also speaks to cancer screening and mammograms for screening for breast cancer or occult blood tests to test for colorectal cancer, for example. And so we do provide financial incentives to our primary care providers to incent them to increase the percentage of their practice that would be screened on time. But again, the HQO report, although it shows progress, it shows that there's a lot of work that still needs to be done. But for me, it points back to, on both of these fronts, to a couple of things. We need to deepen our partnership and collaboration with our frontline healthcare workers, the OMA, and it's not just the doctors we're talking about, it's also nurses, nurse practitioners. We need to have those collaborations and partnerships as strong as possible so we can work together to make improvements. But it also points to the importance of information, right? So I'm a big fan of collecting this data. I'm really happy that HQO has published this report because it's publishing data that's really important and meaningful to Ontarians and that they can relate to, quite frankly, because everybody has an experience probably of trying to get in to see their family doctor, or people wait time to see a specialist, or screening for this or that. The HQO report providing that information in a transparent fashion is incredibly important, I think, to encourage the system to do.